Medical revalidation of Puerto Rico, DNR in a patient with drug overdose. Clinical question. A 35-year-old patient is brought to the emergency department after an overdose on illegal drugs. After regaining consciousness, the patient requests to sign a do not resuscitate DNR order. What is the most appropriate next step? A. Allow the patient to sign the DNR and document their wishes. B. Assess the patient's mental capacity before considering their request. C. Proceed with life-saving treatment as overdose patients cannot refuse care. D. Honor the patient's request and inform the medical team. Correct answer. Assess the patient's mental capacity before considering their request. Explanation. Patients have the right to refuse medical treatment, including signing a DNR order, if they have decision-making capacity. However, in the case of a drug overdose, the physician must first determine whether the patient is alert, oriented, and cognitively intact, able to understand the nature and consequences of their decision, free of intoxication, confusion, or psychiatric impairment. Drug overdose can cause temporary cognitive impairment, e.g., altered mental status, delirium, suicidal ideation, making the patient unable to make informed medical decisions. Therefore, a capacity assessment is required before honoring a DNR request. Why not the other options? A. Allow the patient to sign the DNR and document their wishes. Incorrect. The patient's mental state may be compromised by the effects of the overdose. A DNR order is only valid if the patient has decision-making capacity. C. Proceed with life-saving treatment as overdose patients cannot refuse care. Incorrect. Patients can refuse treatment if they are mentally competent. However, in an overdose setting, mental capacity must be evaluated before honoring a refusal of care. D. Honor the patient's request and inform the medical team. A DNR should not be signed in an emergency setting without proper evaluation. The medical team must first determine whether the patient is competent. Key takeaways for the medical revalidation of Puerto Rico exam. A DNR order is only valid if the patient has decision-making capacity. Patients with drug overdose may have altered mental status and require a capacity assessment. If a patient is intoxicated or confused, the DNR request should not be honored at that moment. Once the overdose is treated and the patient regains full capacity, they may revisit their decision. This question tests ethical decision-making and patient autonomy in emergency medicine, a high-yield topic for the medical revalidation of Puerto Rico exam.